Hi, I'm Dr. Kenny Levine. I'm here with Dr. Bob Swinger. You know, you talked, off camera, we talked about a wellness for service dogs. You know, in dentistry, April is Oral Cancer Awareness Month, and in our office we're doing oral cancer examinations with a light that was developed by the MD Anderson Cancer Center. We're charging just half our fee for this. Tell us a little bit about your program that's going to go on in April and then into May.
You know, one of the things that the American College of Veterinary Ophthalmologists, has been doing the last couple of years is a program. It's our annual Service Dog Month, and it's the month of May. So starting the month of May, but ophthalmologists across the United States, or whoever, not every ophthalmologist is participating, but certainly most of them are offering free exams to any service dog. And that dog can be a military dog, a police dog, a therapy dog. Any dog that's a registered therapy service dog is eligible. And what we are doing is the clients need to go to there's a website for the service dog group, and they can go there. They go to the American College of Veterinary Ophthalmologists website, which is www.acvo.org. They can sign up their pet, give them the information. Basically, it's just to verify that they're a service dog, and then schedule their appointment for the month of May.
You brought up service dogs. Are there any places these animals are not allowed to go? To go wherever a person goes?
I think a service dog can pretty much go anywhere they want. I fly every 2 weeks back and forth and do some consulting in Chicago, and I see service dogs, more and more of them on planes and flights, and no matter where I'm at.
Gotcha. Let's talk about the larger animals now.
Yeah.
We're talking about service dogs and things like that. So if I was fortunate enough to own racehorses, or as a wealthy rancher, I had a lot of cows and whatever else they have on the ranch, you know better than I. Would they request a veterinary ophthalmologist to come out and check their herd, check their stables, things like that? How is that handled?
You know, in a lot of large animal, unfortunately, it comes down a little bit more to, most farm animals are on the farm for profitability, and
right.
So I don't think that it's not feasible for a farmer per se to have an ophthalmologist come out and do things. Now, certainly at the university setting, when we had a lot of show cattle or we had some show animals, they would come in. But most general practitioners are going to be taking care of a lot of the large animal. Now, the equine, the race horses and the insured horses are a whole different ball game, and so those horses are very valuable, and we carefully do our work, and we do see a lot of them. I mean, we see a lot for scratches and ulcers. There's some chronic inflammatory diseases that we see. There's some horses will be born with cataracts, and so we have to go in and do cataract surgery on these horses. But especially in Florida, one of the things we see the most is fungal infections in the cornea, and so they don't like to respond real well to treatment. So it's pretty darn aggressive therapy.
Now, every time you see an animal for a diagnosis or test or a procedure, they put to sleep for that? Most of our patients are not even sedated. Most dogs and cats are pretty darn good. I can probably count 15 that we've actually had to sedate to do our exam, because it really does kind of alter my exam. I want to see how well they can see in their peripheral fields, and so it does kind of change things a little bit. Now, equine, most of the horses we will sedate a little bit. Obviously, the animals we're at the zoos and things like that, we do have to sedate. But believe it or not, once the light shows start and the lights go out in the clinic, most of our dogs and cats tolerate it pretty darn well. Is there ever a procedure where you do corrective surgery to improve vision for an animal?
You know, we probably do 3 or 4 cataract surgeries a week. And these are on dogs that either have age cataracts, they've got cataracts secondary to diabetes or genetics. But certainly we're taking dogs that may have not seen for 3 or 4 months, or even up to a couple of years, and they may be stone blind, and all of a sudden they wake up from surgery and they have their normal vision back again. At the time of cataract surgery, just like in humans, we're taking their cataracts out, implanting artificial lenses back in replace of that. It's exactly the same procedure that you would have yourself if you had cataract surgery.
That's fascinating. We're going to come back in just a moment because we have to talk a lot more about all the things that you do.
Okay.
It's Dr. Kenny Levine with Health Talk. We'll see you in just a moment. Thank you.
Don't you wish your girlfriend was hot like me? Don't you wish your girlfriend was wrong like me? Don't you wish your girlfriend was